for stem.
Okay, ma'am.
Okay, so if you've read and understood, considering it critical care scenario, please tell me, how are you going to manage this patient now?
According to the scenario, I'll manage the patient according to the ABC protocol. I'll check the area
Yes.
and breathing. Here the oxygen saturation is less, so I'll give
Yes.
the oxygen to the patient. And the circulation, check the
Yes,
pulse,
how much
blood pressure.
oxygen and through what type of mask?
Nasal mask, ma'am.
Okay, and how much?
100% oxygen.
Okay.
Then I'll establish the IV channel and give the fluid and monitoring the patient in the ICU.
Okay, and how are you going to take care of the blood pressure
Yes,
of the patient?
I'll give the fluid to the patient to increase the blood pressure, and the cardiac monitoring also consider the patient.
Okay.
And the alpha blocker I can consider in this patient.
Why alpha blocker? Why would you consider alpha blocker? You have mentioned, okay, this question you can answer me later. You've
Okay.
mentioned that you'll take care of this patient. You'll do cardiac monitoring. Just
Yes,
as
ma'am.
part of your cardiac monitoring, you have asked for this ECG. Just suppose this belongs to this patient. Can you help me and read it for me, please?
Yes, ma'am. Yes, ma'am. There is a positive in lead 1 and FEL, and the negative in the lead 2 and FEF, and there is the left axis deviation that indicates the left ventricular hypertrophy.
Before you read an ECG, can you just say, okay, this is a 12 lead ECG, or, I mean, if you can describe what you see, because there is definitely, how many leads could you read? 3 and 3, 6.
Three. Yes. Yes,
So
ma'am.
in lead 1, there is positive upwards
Yes, positive. Upwards direction. Yes, ma'am.
direction. Yes, and this is
And
lower.
the AVF,
AVL is also
yes,
also above. Yes.
upwards direction.
So what does, how would you read this ECG? What would you say? What has happened to the patient? And the patient is not a post-op patient. It was booked for surgery. So it's a pre-op
yes,
patient. So
yes, ma'am.
what's happening? What precautions would you keep in your mind as a surgeon, and how would you take care of the patient next?
Yes, ma'am. This patient may be the case of the aortic stenosis.
Okay, why?
So there is a positive lead in lead 1 and FEL, and the negative in lead 2 and FEF.
Okay.
In lead 2 and FEF, there is a downward direction of the
Yes.
QRS complex.
Yes, and negative lead in AVL, that signifies what?
That is the downward direction, the lead 2 and FEF.
How would you interpret if there is left axis deviation of the heart or right axis deviation?
Yes, when
Left
there is
ventricular
the
hypertrophy or right ventricular hypertrophy?
here
How would you?
yes, if the both directed upwards, then the left axis deviation.
Yes.
But
Okay.
if one is if there is a downward direction, then it indicates the right axis deviation.
Okay. What is aortic stenosis that you have talked about?
Yes, is the calcification and thickening of the aortic valve
Okay,
and
right.
the aortic valve thickening and the cause of obstruction of the flow of the blood.
Okay. So what is basically the pathophysiology behind aortic stenosis? This probably will
Yes,
help and understand the condition of the patient. All of a sudden, central chest pain and shortness of breath after one
this
episode of vomiting. What might have happened?
this may be the senile calcific aortic stenosis
No.
or or maybe the
Why oxygen saturation has
post-inflammatory
dropped?
scarring, post-inflammatory stenosis, scarring, fibrosis of the patient.
No. What happens here?
The
Why oxygen saturation
drop,
has
drop,
dropped? Yes, why? What happens when oxygen saturation drops?
patient cannot take the breath properly.
Okay, so that has led to decreased cardiac output.
Yes, ma'am.
So decreased cardiac output will result into, okay, if I take you back and I request you to think, heart gets its blood supply from where?
Coronary artery, ma'am.
Yes, coronary arteries. And coronary arteries arise from where? From two of
Aorta,
the,
aorta,
no, two of the aortic cusps. Which two?
aorticus,
Yes.
aorticus.
So if there is decreased cardiac output, that has resulted into
Decrease
limited or
cardiac out.
ischemic blood supply of the
Yes,
coronary vessels, right? So that
yes,
has
yes, ma'am.
decreased. What has that has resulted into what? Okay, please tell me, how would you define afterload? How would
Afterload, it
afterload
is,
will be affected here
yes, ma'am. Afterload, afterload is the filling pressure of the heart at the end of the diastole.
at the end of the diastole? Okay, in
Yes,
this
ma'am.
scenario, when cardiac output has decreased, coronary blood flow has decreased, might have led to compromise of cardiac tissue or ischemic. Then how would it affect afterload? How would it affect? Okay, preload, afterload. These are the
Yes, yes,
terminologies.
ma'am.
I want you to help me and understand that what
Yes,
is happening actually.
after afterload is the tension in the ventricular wall during the ventricular ejection.
Yes, and this will also decrease.
Yes, ma'am.
Okay, and left ventricular end diastolic pressure. What would happen to that?
That is the afterload.
Okay, this
It's
is the
increase.
afterload we're talking. Afterload,
Yes, ma'am.
okay. Left ventricular end diastolic pressure will increase. This will
Yes, ma'am.
result into decrease of what? If you can help me
Decrease in,
understand.
yes, ma'am. It decrease the coronary supply.
No, what is CPP leads to?
It's the, yes, ma'am. CPP is the
CPP is
systemic
abbreviation for what? Yes, please.
coronary perfusion pressure.
Okay, what would happen to that? It will decrease.
Decrease.
This
Yes,
will
ma'am.
result into what?
There will be the ischemia in the heart.
Yes, subendocardial ischemia.
Yes,
And this
yes, ma'am.
subendocardial ischemia has resulted into dyspnea and
Yes,
maybe
ma'am.
angina.
Yes, ma'am. Angina, right, right.
And maybe if patient has become
Chest pain.
unconscious, so syncope. So that is the situation which has happened. All right, time has gone, but tell me very quickly, because this was not covered. If you do not get to manage this patient on time, what are the complications that would result due to the
Okay, ma'am.
presence of
Patient may
aortic
develop
stenosis?
the pulmonary hypertension, the arrhythmia, uh, angina, infective endocarditis, ventricular tachycardia, ventricular fibrillation, heart failure, and this even death of the patient.
Sudden cardiac death, yes.
Yes, sudden
At
cardiac
the
death.
end, okay. How would you confirm your diagnosis? What investigation in this
Yes,
scenario
ma'am.
can you do?
Yes, I will do some investigation. I'll do the ECG already mentioned.
Already
Then
done?
I'll go through the 2D echo and transesophageal echocardiogram. I also consider the troponin I.
Okay. Uh, all right. What would you do with the elective surgery that you have booked for this patient?
Uh, Elective surgery, I can delay the surgery because if the aortic stenosis, the diameter of the ventricular surface area is less than 1.5 square centimeter, I'll consider the valve replacement or valvoplasty first, then followed by surgery.
Okay, but here, look, this to RBT, okay, though it was elective, but why was it booked? What might happen if
Yes,
you
patient,
delay surgery?
if there is the malignancy patient, the
Yes,
spread of the malignant cell.
yes. Okay, and according to the NICE guidelines, what does it say about a patient who is diagnosed with preoperative aortic stenosis, and when it comes to antibiotics prophylactic for that patient?
Yes, we will consider the prophylactic antibiotic to prevent the infective endocarditis.
Okay, last question. Please have a look at this ECG as much as you can and help me to calculate or calculate it for me heart rate out of this.
Yes, ma'am. I will calculate the 300 divided by a large square in between RR interval. 300 divided by large square in
Okay.
between RR interval. Here is the
Rhythm is the
300
patient is
divided by
having,
3,
yes. So rhythm is
100.
okay. Heart rate is 100. Okay, one thing is that I was not happy with the definitions and with the sequence. So I would request you to read the pathogenesis and pathophysiology of
Okay,
this
ma'am.
whole
Okay, ma'am.
stem
Aortic
again, please.
stenosis.
Yes, aortic
Yes,
stenosis.
ma'am. Yes, ma'am.
Mm, read through it and then we'll go through it again sometime.
Okay,
Thank
thank you,
you.
ma'am.